Ma'am, you will have to exit the screen share right now. After the introduction, you can
Okay,
do it again.
so I'll stop the share.
Yeah, ma'am.
Yes, ma'am, right now.
Okay.
Ma'am, should I begin?
Yeah.
Ma'am, you will have to exit the screen share
Yes,
right now. After
Akshita
the
and Misbah, you
introduction,
can
you
start.
can
We are live.
do it again.
Okay, ma'am. A very good evening, everyone. I, Dr. Misbah Kadri, and Dr. Akshita Gupta will be the moderators for today's session. We welcome you all to the Cynodent International and Indian Society of Dentistry webinar series 2023. Theme of the series is Unlocking the Trends in Dentistry. For the first session of today, I would like to invite Dr. Neeta Misra, ma'am. She is Managing Director at Misra's Dental Clinic. She is President at Indian Academy of Oral Medicine and Radiology. Topic for this session, Nanotechnology in Medical Diagnostics. I would like ma'am to please start with the session.
Thank you, Vishwa, for introducing me to the audience. And this topic is innovative in dentistry, as well as many years it has been used in dentistry. But now we are, can you see?
Yeah, ma'am.
Okay. So, very good evening to everyone. And this topic is uses of nanotechnology in medical diagnostic application. So, dental is also a part of medical only, like whatever we are doing for health of the patient, our society. So, this nanotechnology has been are used in many types, like in our materials, in our diagnostic applicants, like many applications are there. So, I wanted to go deeper in this. So, this is an innovative field. So, this topic, nanotechnology, is has many overlapping things. Like it is also used in medicine, in chemistry, in engineering, biology. So, this is a combination. And now, at present, we can't say that any of the field is not using nanotechnology. So it is, I have told only four, five, but there are many such field which is taking care of this technology. So, like, what is the approach? First, top down and bottom up. There is two things. Like when you think of going down small things, then or from small things make bigger. These two types of things are there. Like in the approach, the bulk material is broken down into nanoscale particles, and then the integrated circuit fabrication is being done. Formation of titanium 02, nano gold, nano silver, carbon nanotubes, and it is using graphite. So these type of top-down model. Then bottom-up model is approaches form material by atom, molecule by molecule, or cluster by cluster. These two types we make the materials. What are the different nano devices? One is quantum dots. You must have heard many times quantum theory, quantum dot, carbon nanotubes, nanoparticles of paramagnetic nature, gold nanopoints, GNPs, novel nanoparticle methods. They all are used in oncological applications. And these type of quantum dots, carbon nanotubes, they are being used in medical from almost more than 10 years, 15 years. But in dentistry also, we have started using this. So going deeper in diagnostics, nanowire used in nanoelectronics, connector for transposition of electrons. Double-stranded DNA is metallized by silver or gold coat between the poles of electrode. You can see in the helical system, there are silicon atoms which are joined by carbon atom. So these two types, and like that we make nanowires. And these nanowires are just like double-stranded DNA is metallized by silver or gold between the poles of electrodes. And these nanowires are made using many different ways. Then generally there is semiconductor essence of gold, silicon, copper, and these are dimension is less than 10 nanometer. Here meter you will listen it is a bigger, but nanometer is really small, which you can't see by your naked eyes. This formulation of polymeric integrated nanowire devices, nanowire deposition on the devices. So these devices are like coated with nanowires. So they can detect easily any change in the DNA, any change in the like at the in the patient's, like you won't imagine that time there will be no clinical symptoms, there will be no patients complain that time also. These nanowires, if deposited in the DNA, that time they can tell that there is a change in the DNA. So these nanowires are aligned in a well-defined direction of the device, detection of sensitivity for the purpose of diagnostic application. So this nanotechnology is not only sensitive, it is specific also. So it is much higher sensitivity and much higher specificity, which makes detection much easier for any of the diagnostician. If the nanowires is reduced from 200 mm to 50 nanometers, then its specificity increases. Concentration detection limit will become 206 times lower. So you will need very less of nanowire and sensitivity will increase much. This used to detect P16 ionic 4A involved in cervical cancer at the threshold concentration of 100 femtogram liter. So you will need so much less of cervical fluid. So this type of thing we get in specificity increases. That time we can have these nanowire can test in the saliva also, in the cervical fluid also. So these kind of problems can be diagnosed much earlier. That is the only thing. People are afraid of biopsy. People are afraid of in the things which are uh, is cutting and all those things that can be done. Then specific antigen protein produced by normal as well as malignant cells of the prostate gland. There also it works uh, much specific. The microRNA or miRNA non-coding sequence between 21 to 25 bases due to its high stability in blood, it controls of oncoprotein expression in the form of cancer biomarker. So when microRNA non-coding sequence is being used, so it is also a cancer biomarker. And as you all know, cancer biomarker are the uh, nowadays in much uh, like uh, uh, like anyone can use these things. It is not so difficult to use. Previously, it used to be a very big thing which has to be go for big cities only. But now it is being done in smaller cities too. Use of an electric field to convert the flow of current in a semiconductor are used for ultra-sensitive label-free detection of biomolecular interaction. To detect the specific DNA molecule, like peptide nucleic acid probes, are immobilized onto nanowire surface and they modify the nanowire which we are using. So this also increases the sensitivity and specificity. Maybe bioinformatics platform to use as rendering system using nanotechnology. So you must be knowing a newer technology which is coming up, that is bioinformatics. Bioinformatics means Like previously, we were knowing that information and all these technology are only used for engineers, not for medical healthcare. But now healthcare and technology both have integrated and made a bioinformatic platform, and this is getting more recognition, and more people are coming up to get the more, these two platforms are making things easier for diagnosticians, and diagnostician can, early detection is the key of the treatment. If we detect early, we can treat early, and chances of survival, chances of like a healthy afterwards, like it is not that we are diagnosing late and then it becomes very difficult to treat. So these kind of things can be taken care, and a patient, if we detect uh, like in a starting phase, the life expectancy goes much more, like 5 to 10, 10 to 15, these kind of things can be taken care. So if we are using bioinformatics, then we are enhancing the patient's life afterwards also. In BCA, like biobarcode amplification, grounded assay decay trace proteins, cytokines, and some neurotransmitters. PCA has the advantage of high perceptivity, short discovery time, simple operation, low cost, good repetition, and good direct relationship between discovery result. So, biobarcode, like you all know barcode. So now we are making this kind of barcodes in with trace proteins and cytokines. So naturally, it will be higher perceptive, short discovery time, simple to operate, just that barcode can be scanned, low cost, good repetitions every time, like it will be easier. Like these kind of things, like what we got in the cancer cells and what for the bioinformatics has given us. We just keep on that data is being entered, and so it is repeated also. Good direct relationship between discovery result. Then the monoclonal antibodies, gold nanoparticles by trisodium citrate reduction method, and coating with anti-target protein antibody and thio-modified barcode DNA. Use of nanocrystals. Now, previously we used nanowires, then bioinformatics, and now use of nanocrystals. What are nanocrystals? They are aggregates of atoms that combine into a cluster with at least one dimension measuring less than 1000 nanometers. So this kind of aggregate which is less than 1000 nanometers. A carbon-based material such as carbon nanotubes and fluorines. Metal-based materials such as gold, silver, metal oxide, and quantum dots. Dendrimers or nano-sized polymers. So they are used the atom of in the to get water answerable like medicines, marketable success in oral medicine delivery, like when we are using poorly soluble drugs, that time they involving drug bioavailability is made more, and improving drug physiochemical characteristic and stability. If bioavailability is more, then the enhanced action will be there, and if the solubility and stability is there, then it will be hold for some time, so that time it can enter the mucosa and treated by surface modifications are done of the crystals. Like you can see, there is a surface is modified that of that nanocrystal, and because of that surface modifications, bioavailability is more and stability is also more. Then man-made nanoscale charges will be transported from the electrons. When ultraviolet light hits these semiconducting nanoparticles, they will emit light of varied colors like blue, green, yellow, red. These kind of light are emitted, and they these emitted light will also take care of the drug will again become more of stable, as well as antibodies will be that core of that cell will be this UV light will hit there, semiconducting nanoparticles, and that they will become more of stable as well as specific. Then graphene quantum dots effectively improve the detector performance with respect to their reproducibility is increased, their selectivity as well as perceptivity is also increased. Then there are some drug delivery systems of artificial cells. Advantages of nanoparticle is their area to volume ratio, which is respectively high. Like area to volume means they are very small in as we think, but they're because of the helicals which we have made that with ultraviolet light and all those things, we make them volume increases. So respectively high, resulting in high loading capacity. So if volume is more, loading capacity will be more. For diverse emerging probes, targeting ligands and therapeutic formulations. As an example, carbon nanotubes has some volume because of the typical protein offers a 15-fold larger area compared with the protein. That previous whatever protein was there, it becomes 15-fold larger. So the mm, treatment will be better. Naturally, it protein will become so much 15-fold larger, than the drug which we are giving can be bioavailability will be more. Then rod-shaped nanoparticles and the polythene glycosylated spherical counterpart showed that the gold nanorods were obsessed to be lesser extent by the liver and macrophages and showed longer circulation time and the next accumulation in the tumor tissue compared with the spherical nanoparticle. So, rod shape, as we know, that is better gold nanoparticles. There are many answers for the several activities. Its application, the medication is secured, becomes new hope in identification, treatment, and interference. In future, there will be measure devices, supported applied sciences, which may build thousands of measure relax and more adding boon towards the medical society. So nanowires, this will be very much easily available, and it will be much easier for a person to get treated with this technology. So in short, I would like to say then nanotechnology is small, is a big. Like this is that very small thing, that nanotechnology will make a big change in our treating and diagnosing oral cancer or these type of diseases. Thank you so much, and I'm very much thankful to Dr. Anmol and both the coordinators, Akshita and Mispa, for organizing this program. Thank you so much.
Thank you, ma'am, for the informative session. Now, I would like to proceed with the question answer round. Though you have answered most of the questions of the delegates through your presentation, but we still have a question for you. What are the necessary skills and knowledge for research in nanomedicine for cancer therapy?
Necessary skill is the first thing is your zeal to know things. And as you know, that there are many such centers like where nano research is going on. You can coordinate with those people, and they are very much in they want that skill to be developed. Only thing you should know the structure of the protein, structure of molecules, DNA helicals, how they work. That is the main thing which we have to learn. They support so much for our research, that if we with some project, they give us money also.
Thank you so much, ma'am, for your answer. I would like to thank ma'am for the informative session, and Dr. Anmol Bagaria ma'am, founder, Cynodent International, Dr. Ashish Chandra sir, Vice President, Indian Society of Dentistry, and my co-host, Dr. Misbah Khatri. Thank you everyone who have joined.
Thank you so much.